Hi Mahtab, how are you today?
Good, how are you?
I'm very good. So I haven't seen you here in a while. First I want to just verify your first and last name and date of birth.
Sure. Mahtab Hijazi.
Okay.
And date of birth is 6/14/1992.
Okay. And so I know I have you scheduled for kind of a head-to-toe exam today and a cranial nerve exam. But do you have any other symptoms or any issues that are bugging you?
It started with me having headaches.
Okay.
Very sharp pain.
Okay.
And it's mostly like at the back of my head. And
Okay.
then recently I also started having cramps.
Okay.
Especially like in my abdomen area.
Okay.
Pain in my legs and knees.
Oh, okay. Wow.
But they mostly happen like, it starts with the headache and then I start having the other symptoms.
Okay. So the other symptoms usually follow the headache?
Yes.
Okay. How soon after the headaches begin?
I would say like maybe when I start the day, like maybe after like an hour or so when I get going, and
Okay.
maybe an hour after like I wake up. So.
Sure. Okay. Do the symptoms get worse when you move a lot and walk?
Yes.
Okay. Do you drink coffee or any type of caffeine?
Mostly water.
Okay.
But yeah.
Any changes to your diet?
I haven't really been having a good diet recently.
Okay.
Trying to get back to eating healthier.
Sure. All right.
Yeah.
No gastritis kind of symptoms? Like, is it digestive or is it more cramping?
More cramping.
Cramping,
Yes.
okay. At the first day of your last menstrual period?
It was February 10th.
Okay.
So.
Very good. All right. And what are you doing to treat the pain? Are you taking anything over the counter?
Mostly Advil.
Okay.
Sometimes I have to take like 3 or 4.
Okay, that's not good.
So, yeah.
Okay, have you tried stretching out the muscles or?
It's a little hard to do it.
Because of the pain?
Yeah.
Okay.
And just heating pads kind of help.
Okay,
so,
that's good. Okay, and then how long has this been going on?
Over a month.
Okay. All right. I'm going to start with your vitals, and we're going to do the head-to-toe exam. But I'm going to really focus on those areas of pain that you mentioned, and hopefully we can come to some form of resolution on this.
Okay.
Okay. Okay. Let's start by listening to your heart and your lungs. Okay. Okay, so just breathe normally for me. Sounds are normal so far. No arrhythmia detected. Okay, I'm going to flip it over and listen on the bell side. Only S1 and S2 present, no S3. Do you have any issues with irregular heartbeat or feeling that your heart is racing?
Only if I do like heavy lifting.
Okay, that's normal, but If it was in the sitting position, then that would be an issue. Okay. And listen to your blood pressure next. Okay, yes, your legs are uncrossed. Okay, that's 118/78. Very normal. Just gonna slide this on. Good. Alright, and we'll take your temperature. Okay, 98.1. These are all normal metrics so far. So go ahead and give me your index finger. Just rest your hand here. Okay, heart rate's a little low, 57 beats per minute. Oxygenation is, oh, there it goes up a little bit. Oxygenation is 98% at room air, so nothing alarming, but you might just be cold. Go ahead and look at me. I'm going to palpate your face. Okay, sorry, my fingers are a little bit cold, but I'm just feeling for any sign, any lumps or bumps or swollen lymph nodes. Okay, lymph nodes are healthy. Pre-regular lymph nodes are healthy. Okay. And post-regulars. Okay, and if you could close your eyes, I'm just feeling right beneath the sinus cavities here. No swelling. I don't feel any facial edema. Your skin is very well perfused. Okay. Just going to feel the back of the head. Make sure there's no signs of a concussion. Okay. Cervical spine feels normal. No abnormal musculature, protrusions. Okay. Go ahead and try to raise your eyebrows for me. Alright, now raise them all the way. Try to lower them. Good. Now turn your head to the left. Resist my push. Turn to the right. Resist my push. Okay. Try to look up at the ceiling for me. Good. Now try to touch your chin to your chest. Alright, very good. Now I'm going to be tugging on your ears. Let me know if you feel a tugging sensation back, up, or down, okay?
Back. Down. Down.
Okay.
Up.
Okay, am I pulling on your right or your left ear?
Left. Right. Both.
Okay. okay? I'm going to be just doing some measurements of your face just to make sure we have symmetry here. Okay. Okay. Seven pairs here. I think it's normal so far. Okay. And 11.5 by 11.5, looking good. Okay, go ahead and open wide for me. Okay, tonsils look normal, gums are pink and moist, normal color, very good. We're going to do a taste test. Okay, any loss of taste or smell that you've noticed?
A little bit from time to time.
Sure. Okay. We'll just do your best here. And with your mouth closed, open, and let me know what that tasted like.
Kind of like bread.
Bread? Okay, that was the test paper. So if bread usually tastes like paper to you, then you're not having any problems. Okay, I'm going to do 2 more. Okay, go ahead, open, close, open. What does that taste like to you?
I feel like the same
Okay,
as the first.
all right. So that was cherry. Definitely would have been a strong scent. Okay. And one more. Open, close, open.
Kind of like a mix of like lavender and like, I don't know, it kind of tastes a little bit smoky too, if that makes sense.
That was sage.
Oh, sage.
Yeah, so very good. That was pretty close. Okay, we're going to test your smell next. Okay. All right. Go ahead and inhale. Let me know what this smells like. These are all very difficult, so.
It's kind of like sage too, I feel like.
It's frankincense.
Oh, frankincense.
But I won't count that against you. This one should be a bit easier.
Citrus?
Yes.
Or oranges?
Orange, yes. Perfect. Okay. This one is not orange, but it's something similar. So try to guess.
Kind of like lavender.
Okay, that was grapefruit.
Grapefruit.
So it's okay. We just have a couple more. And this one, I don't think. This one is very difficult, so you don't have to get it completely right.
Kind of like almonds.
Bergamot.
Bergamot.
And one more.
Kind of like jasmine, I think, but it's warm.
Yes, it's sandalwood.
Sandalwood.
So you're slightly up on those. I'm not so much worried about those as I was about the taste. Because at least you can smell the variances. Okay. 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 So I have a few different tuning forks. This is going to test your sense of vibration on your resonance chambers of the skull, and also kind of your hearing, but I'll be looking at your ears as well. So just close your eyes. I'll be placing this in different sections of the head. Let me know when the sensation stops. If you feel the sensation going, but the sound stops, or vice versa, let me know that too, okay? All right. Okay.
Yeah.
Good.
Stop.
Okay.
Stop. 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 Stop.
Okay. And this next one you should more just hear instead of feel.
Stop. Stop.
Okay. Now tell me which is louder, A or B. Here we have A, and there's B.
B.
Good. You have A and B.
B.
A and B.
A.
A and B.
A.
Okay. Okay. I'm going to be looking inside your ears next. Go ahead and look straight ahead for me. Healthy and normal, no excess wax. And your tympanic membrane is an appropriate color gray. Very good. So, I'll look at your eyes next. Any vision problems in the last year?
No.
Okay, good. Go ahead and look straight ahead. Sorry about this bright light. Your pupils are round and reactive. No jaundice, excess veins, redness of the eyes. Looks perfectly healthy to me. Go ahead and blink once. Okay, look to your left. Look to your right. Look up. Look down. Any difficulties in doing that?
No.
Okay, good. Okay. Go ahead and look straight ahead. Same thing here. I'm not seeing any issues. Go ahead, look up. Look down. To your left. To your right. Any difficulties?
No.
Okay. So go ahead and let me know when my fingers enter your field of vision. Just say no.
No.
Okay.
No. 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 No.
All right. Let me know when my fingers leave your field of vision.
No. No. No.
Okay. And which fingers are closer to you? The fingers on your left or your right?
Right.
Okay. What about now?
Left.
Okay. Which fingers are moving? The ones on your left or your right?
Left. Right.
All right. Go ahead and grasp this Snellen chart for me. Hold it at arm's length. Good. Could you read this fourth row here?
O L C F
Good. What about this row right here?
E P T C O.
Good. And the last row?
L T F P H.
Good. Any difficulties there?
No.
Didn't seem like it. What color is this?
Red.
What color is this?
Green.
And which circle is larger, 9 or 6?
9.
6 or 3?
6.
3 or 2?
3.
Good. All right. Okay, so next I'm going to have you lay down in the bed, and I'm going to more closely examine those areas of the body that you mentioned. Also going to do an abdominal exam and take a look at your feet as well.
Okay.
Okay, so with your permission, I just want to lift your shirt just a little bit, just to take a look at your abdomen. Okay, very good. I'm seeing a little bit of inflammation, a little bit of redness here. I'm gonna go ahead and give it a listen, and I'll do some palpations. Okay, so you can just breathe normally and relax. It's gonna be a little cold. Okay. Sounds are normal. Just some normal gurgling. Okay. Everything sounds pretty normal to me. I'm going to just do some palpations. So I'm going to be pressing lightly on your stomach. I know you're having abdominal pain, so if it gets to be too intense, let me know and I'll stop, okay?
Okay.
All right.
Yeah, it hurts a little
A
there.
little bit there, okay. And actually, so this would be the main point of hurt. Let me know when the pain subsides as I move toward the side of the stomach, if it subsides at all.
Yeah, I think it's the same amount of
It's
pain.
the same?
Yeah. Yeah, even to the right side.
Okay, what about when I go up?
It's a bit less. Yeah, it's a bit less.
Okay. And then as I go to the side, is it the same, worse?
Less.
Okay.
Yeah, right there.
And it's painful here?
Mm-hmm.
Okay. So we have right here in the center to the
Yeah.
side here. So it kind of goes on a vertical. What about here in the sides?
It's mostly in the center, but the sides also hurt.
Okay, I'm going to press very gently on the sides of your stomach. Let me know if you have pain there.
Mostly on the right side.
Okay, on the right. What about here?
Yeah, on the right mostly.
On the right, okay. And the same here.
When you go up, it's a little bit less
Okay,
pain. Yeah.
all right. So it's mostly in the center to the right.
To the right.
And on this diagonal here.
Mm.
I'm going to go ahead and write that down. I'll do some measurements as well.
Okay.
Okay. I'm going to go ahead and just check for signs of symmetry here. Okay. It's 25 here. And on the right quadrant, 25 exactly. Okay. This is 15 centimeters and 14 and a half. Okay, 13 and a half. Okay, so these seem to be symmetric and normal. I'm going to take a culture of your belly button just to make sure that it's a really nice piercing. I just want to make sure there's no infection or issues there that could be causing some of the pain. So, sorry. Okay. Sorry. Any pain or itching there?
A little bit of itching.
Okay. seeing just a little bit of redness above the belly button. I'm going to apply some foaming solution. That's just a general cleansing agent. And it should help a little bit with that.
Okay.
I do think that the cramping you're experiencing is probably coming from something else, but I just want to alleviate any bacterial kind of issues that you might be having.
Okay.
Go ahead and just lower your shirt now. I'm going to just assess the knee and the hip. I'm going to very gently do some simple movements to assess your level of mobility and pain. Okay? Okay, Mahtab. So please stop me if it gets to be too painful, but I'm going to gently lift the leg. Okay? And then what I'm going to do is just turn your knee to the right.
Okay.
I'm going to do just some basic movements. So just give all the weight of your leg to me. Okay. And on a scale of 1 to 10, what would be your pain right now?
I think 5.
Okay.
Yeah.
I'm just going to rotate the front leg. Just give all your weight to me.
Okay.
Circular motion. What about your level of pain there?
I think it's more when I do the circular motion to like maybe like a 7.
It increases?
Yeah.
Okay. Just feel the knee joint. Pain here?
Maybe like 4. Yeah, like 5 or 6.
Okay. I'm going to just turn your leg this way. Painful here.
Yeah, that's like an 8.
Okay. And I'm bringing it outward, just very gently. Is there pain there?
The pain's more when we go to the right.
Like to the right?
Yeah.
Okay. I'm going to slightly lower it. Okay. I know you mentioned a bit of hip pain, so I'm just going to press very gently on your hip. Scale of 1 to 10.
Like 4.
Okay. Scale of 1 to 10.
Oh, that's a 6.
Okay.
Yeah.
All right.
As we go lower, it's more.
I think it's more here.
Yeah.
Okay. I have something that I think might help a little bit. It's not going to completely heal it, but it just kind of evens out the muscular formations. Just curves in the shape of your leg. Let me know if it gets to be too much.
I feel like it's helping a little bit.
A little bit. Just evening out the pain if there's a targeted area that has a lot of it.
Yeah.
Okay, going on the other side as well. Scale of 1 to 10, how would this be?
Like 7.
Okay. And what about now?
Like 7.
Okay, so it's a little bit more on that side.
Yeah.
Let me go a little bit more gently. Just to even out. And this is going to be a temporary solution. Obviously, we want to get some imaging done, but okay, I'm going to give this dog back to you. Now we'll be just palpating the knee. Is the pain here equal as the one on your left side?
A little bit less, but there's still pain.
Okay. Okay, and as I draw my finger down, is it more or less painful?
Less.
Okay, and what about up?
It's more when it goes
More.
on.
Okay, so this is kind of the targeted area. And we may have an injury to the quadriceps. Okay, go ahead and just prop up your knee like this. You feel behind the knee, is it just as painful back there?
Not as painful.
Not so much?
Yeah.
Okay. That's a good sign. Go ahead and lower it. Okay. Yeah. But I want you to try to spread your legs outward and resist my push. Okay. Now bring them out a little bit. Try to bring them in toward each other.
Yeah, that's painful.
That's painful. Okay. And try to lift your legs in the air. Is that painful?
It's even more.
Okay. All right. That's kind of what I thought. Okay. I'm going to go ahead and just look at the feet and ankles.
Okay.
Okay. Just palpating down here. Any pain?
Not as much. Maybe like 1 or 2. Like.
Okay. That's good. I'm not feeling any edema. I'm just going to measure to be sure. 24 centimeters. Normal. Okay. Just going to do the other side. Here. And 29. 29 here as well. Okay. So I'm not seeing any edema. Okay. Just gonna look at your ankles real quick. I don't see any swelling here, so that's really good. Okay. All right, Mahtab, so this concludes our exam today. I'm gonna order some tests to be done for you because I just wanna rule out anything that would be more complicated with your abdominal area. I'm gonna order an MRI and also just to get imaging of your legs too. Okay?
Okay.
And so we just want to see if there's any internal tears or anything else going on. Other than that, aside from your sense of taste, which I put a bookmark in to check for next time, you're perfectly healthy. So hopefully we can get to the bottom of this, and thank you for allowing me to do this exam today.
Thank you.
Do you have any questions?
No. Thank you so much.
All right, great. Well, we'll take care of you out front, and I'll see you again soon.